Death toll in Gaza has officially surpassed 35,500 people killed since the start of the Israel-Hamas war, and looming behind the shadow of war is famine and starvation. This weekend, health officials in Gaza say more than a dozen children in a single hospital died of malnutrition. Joining me now is an Ontario doctor, Yipeng. He's just returned from Rafah, where he was caring for the sick and injured. Doctor, first of all, thank you for joining us. I guess the first thing to ask is, among what you saw, what can you share with us tonight?
Yeah, thanks so much for having me. The things that I saw as a doctor and working in multiple primary care centers in Rafah, and also seeing some of the other patients and healthcare workers that have been working tirelessly for patients in other hospitals, and also in Khan Yunis, is just, I'm kind of at a loss for words as to, the overlapping crises of food, water, and shelter insecurity that, really amounts to forced starvation and malnutrition of young children that are dying from preventable diseases like respiratory infections, gastrointestinal infections, and hepatitis A. We saw patients that have had severe malnutrition to the point where they're not even able to walk anymore when they were able to walk before. Conditions such as rickets disease, severe vitamin D deficiency that, I think many physicians would have never seen in their entire careers had it not been for a situation like this, like a genocide where people are being forcibly starved, and the number of children that are dying from severe malnutrition are now in the double digits. And this is only going to worsen because the humanitarian aid is still not being let in, and we're seeing airdropped aid that does not nearly start to meet the needs of the population, and is really only performative at this point, recognizing the absolute need for a ceasefire and absolute need for humanitarian aid to actually reach the population, to reach their needs. And I think the moral distress that doctors that go to Rafah, to Khan Yunis, to Gaza, to do what they can, and then to come back to know that so many patients are still dying, and to know that our healthcare workers there, that are our colleagues, are being targeted and attacked and killed, despite their perseverance to continue to do their work for their patients and community. I really do not know what to think of the quote unquote politicians and leaders that have the ability to hold Israel to account for its actions on the international in the international community.